Hello and welcome. In this explainer, we're going to talk about antibiotic prophylaxis for patients who have cirrhosis and are experiencing an upper gastrointestinal bleed. All right, here's what we'll be going over. We'll start with the rationale, then look at the evidence. After that, we'll cover guidelines and therapy, how to apply this to specific patients, and finally, clinical implementation. So let's start with the why. What's the rationale for using prophylaxis in the first place? Okay, so the main thing to know is that patients with cirrhosis who experience an upper gastrointestinal bleed, that's UGIB, are at a really high risk for developing bacterial infections. And why is that risk so high? Well, it comes down to two main things: the immune dysfunction you see in cirrhosis and something called bacterial translocation. That's just when bacteria from the gut manage to get into the bloodstream. When these infections happen, the consequences can be pretty severe. We're talking about increased overall mortality, a much higher chance of rebleeding, and of course, longer hospital stays. Okay, so we know the risk is there, but how well does prophylaxis actually work? Let's look at the evidence, because the benefits are pretty clear. First off, looking at meta-analyses, prophylactic antibiotics can cut the rate of bacterial infections by more than 60%. That's a huge reduction. And that directly translates to better survival. Mortality that's specifically from those bacterial infections drops by about 70%. You know, when you look at the bigger picture, this contributes to a reduction in overall mortality of right around 30%. And there's more. The risk of rebleeding, which is always a major concern, goes down by approximately 40%. Finally, it even impacts hospital resources. On average, it can shorten a patient's hospital stay by about 4 days. All right, with all that evidence, what are the actual recommendations? Let's get into the guidelines and therapy options. Across the board, international guidelines point to a pretty standard duration, 5 to 7 days of prophylactic antibiotic therapy. Now, what about the choice of antibiotic? Third-generation cephalosporins like ceftriaxone are often recommended because they offer great broad-spectrum coverage. Quinolones, such as ciprofloxacin, are also effective, but you have to be mindful of increasing resistance. And then you have beta-lactams, which are another alternative. But it's not a one-size-fits-all situation. The final choice really has to be tailored. You always need to consider two key things: your local bacterial resistance patterns and, of course, the patient's allergy status. This brings us to applying this to specific patients, and that all comes down to stratifying their risk. This is really important. We have to separate patients into high-risk and low-risk groups. For your high-risk patients, think advanced cirrhosis, Child-Pugh A, prophylaxis is strongly recommended. But for low-risk patients, those with early-stage cirrhosis, maybe Child-Pugh A or B, the benefit isn't as clear-cut, so you might actually withhold prophylaxis. And that's the whole point of risk stratification, right? It's all about balancing those clear benefits against the very real risks of antibiotic overuse, like resistance and side effects. Okay, so let's put it all together. What does this look like in day-to-day clinical practice? Here's a step-by-step approach. It's a pretty straightforward process. Step 1, confirm the upper gastrointestinal bleed in your patient with cirrhosis. Step 2, assess their risk using a tool like the Child-Pugh score. 3, for those high-risk patients, get the appropriate antibiotics started right away. 4, remember that prophylaxis is just one piece of the puzzle. It's part of a bigger care plan that includes endoscopy. And finally, step 5, keep a close eye on the patient for any signs of infection, even while they're on prophylaxis. So that leaves us with this big clinical question to think about. How can we best balance the proven, life-saving benefits of prophylaxis with that growing threat of antibiotic resistance? Finding that sweet spot, well, that's the ongoing challenge for all of us.